Yes, you're tuned to the Teabba Radio Network. Thanks for your company across the Teabba Radio footprint. Now, every week we do a regular segment, which is all things audiology, with Mr. Salimon Joseph, who is from Territory Hearing. Now, we're going to do a bit of a recap because we've been together doing shows for about a year. Would that be correct?
Absolutely.
So we've discussed a lot of things on our regular chats because that's what we do. We have chats. We don't do interviews and big long stories. We have chats. So we've chatted a lot about a lot of things, and in particular, the importance of actually being able to hear, because when you're young, to get your baby's hearing checked out, because how can you learn the language of the culture if you have problems hearing?
Absolutely. So that is the most important thing. When a baby is born, they should have very good hearing. Unfortunately, a small section of the society, a small percentage of the children born with different levels of hearing loss. It can be mild hearing loss or moderate or profound hearing loss. So it's so important, as you know, as you said, Brendon, there is a close correlation between hearing and speech, because if the children cannot hear, they cannot mimic what the dad and mom says, and they cannot learn language. So that is why, especially in the indigenous culture, the oral tradition is the way to learn language. So for in that particular scenario, the hearing is so vital for the new generation to pick up dad's and mom's language. But in the wider community, hearing is so important to develop language. Even though there is a script in different language, they have to hear. That is the first modality to mimic. We hear, we mimic, and we learn language.
Yeah.
And when we come to basic language and then moving to school, the children need to learn from their teachers different science and technology, different aspects of the everyday life. And to become a professional also, you need to interact with the people.
Yeah.
Sign language is a language, is a universal language, but it has got its own limitation, And as a broadcaster, you cannot use the sign language in a TV station or a radio station to communicate to the wider audience,
Can I ask a question? This
Yes,
might
please.
seem like a silly one, but is all sign language the one language, or do you have different languages in different countries?
There are different languages. That is my understanding. But Auslan is a very popular way of language, sign language used in Australia.
Yeah.
And it would be different in different countries. But there are some common thread. The signs they use for common things, but you need to learn. I am not an expert in sign language.
Yeah.
I haven't learned sign language, but luckily in Australia, if a client with no speech coming for a consultation, the interpreter service will help to translate what they are saying to a clinician, even if it is a or doctor appointment or an audiology appointment, because they need to communicate. They need to address their problems to the right person. So there need to be the mediator. They will be helping the clinician to interpret what they are saying.
Yeah. Because as we grow, especially children, they need best kind of start in life. So to just get their hearing checked out, because I know back in the days, your parents were kind of telling you to do things, and now it was either kind of like, okay, we're going to go and get your hearing checked because you're not listening to me. And sometimes that might be the case because they might be having trouble with their hearing, or it might be simply a case of actually going and getting microsuction, the wax out of your ear. But either way, hearing is very, very important, and we should do what we can to protect it.
Absolutely right. It's not because I am an audiologist I am highlighting the importance of hearing, but I realized when I started my audiology career, I did my Master of Audiology studies in University of Queensland, one of the very popular University of Queensland, Melbourne University, and there are 7 universities teach audiology, and Charles Darwin University is the newest addition in teaching Master of Audiology studies. And when you think about in one batch, there will be around 30 students to study Master of Audiology studies. And when we think about 30 into 7, 210 audiologists graduating every year from 7 universities in Australia, and the prospect of becoming an audiologist, because in the community is so important. Our community people, there should be youngsters coming forward to study audiology, because when our client we can communicate within their own language, that is a profound difference for the people, the clients. And that is why I speak 4 languages, when people from different nationality, because Darwin is a multicultural capital of Australia.
Certainly is.
Many nationalities, maybe due to the proximity to Asian countries, there are a lot of
That's a good
people.
point, yes.
Yeah, and that is why our First Nation children need to study audiology, and you can serve your people. And previously I was telling you that there are different specialization where a graduate audiologist can work. If you have interest in spending time with the children, pediatric audiology, you can specialize as a pediatric audiologist, and you can do hearing assessment for newborn children, diagnostic audiology assessment to newborn children, to toddlers and teenage boys and girls. But at the same token, if you are interested in spending looking after the older people, you can do hearing assessment on a geriatric population, older people, adult audiology assessment, and then hearing aid fitting, hearing aid fine tuning, all those things you can do. But if you have an academic interest, you can become a lecturer in 7 universities. And the other important thing is all hearing aid manufacturing companies need audiologists, and all companies which manufacture audiology equipments also need audiologists at their research center. And there is one specialized area is cochlear implant mapping. When someone has got cochlear implant, what is cochlear implant? Is artificial ear.
Yeah.
So it need mapping. The programming of cochlear implant is called mapping. So that need an audiologist who specializes in that particular area. And there is another area is called intra-operative monitoring, where when the surgeon does the brain surgery, an audiologist, specialized audiologist, need to monitor what is happening to the auditory nerve. That nerve need to be intact.
That is quite a lot to take in, so we are going to take a short break, and we will be back with audiologist Mr. Salimon Joseph. I'm going to talk to him about what got him into audiology. Anyway, thanks for coming here on Teabba Radio, your voice in the bush. All right, we'll just check. Yes, you're tuned to the Teabba Radio Network. Thanks for your company across the Teabba Radio footprint. Now, every week we do a regular segment, which is if you have
Of hearing loss, it can be mild hearing loss also. You have a powerful voice.
thank you. Okay, so we'll just save that.
They're so caught up in appearance.
Yes, you are tuned to the Teabba Radio Network on the morning drive. Sorry, I'm going to start that again. I try not to give it a timestamp, because that way it doesn't matter what time of the day it is. Bit of Monday orders, mate. All right, thanks for coming and welcome back to the program as we talk to Mr. Salimon Joseph, who is a family member here at Teabba Radio. And we've been doing regular chats regarding all things hearing for a number of years now. I've always been curious as to how you actually got into audiology. What was your interest?
It's a very interesting question, Brendon, because when me and my wife migrated to Australia in 2001 in Brisbane, I never heard about a profession called audiology. Back in India, I am originally from southern part of India called Kerala. There, the master's degree is hearing and speech. They combined study. They study audiology and speech pathology. There's a combination.
Right.
Yes, but in Australia, there is audiology, either audiology or speech pathology.
Okay.
So there is
Learn something new every day.
absolutely. So and then I come across a couple of audiologists in Brisbane, and when I migrated, I had a science degree in mathematics, and my sub was physics and statistics in my degree, and the main was mathematics. And then I did my master of business administration in marketing and migrated to Australia. And then when I was teaching people how to drive, I used to be a driver trainer for 1 or 2 years in Brisbane. And then I come across a couple of audiologists as my students. And they told me, Salimon, if you can do one more master's degree in audiology, and then it's so easy to get into a job in Australia, because audiologists are in high demand.
Yeah.
Because the hearing problem is increasing rapidly.
Is there, would you say, a shortage of audiologists, people getting into the profession?
There was a shortage of audiologists for many years. That is why you will see a lot of Filipino, Indian audiologists coming to Australia, because they were recruiting, many private companies were recruiting audiologists from overseas. You will see a lot of doctors here also are coming from overseas, Sri Lanka, India, and other parts of the Philippines, because we are not producing sufficient professionals in Australia. For Australia, the advantage is if you open up with a strict guidelines and a protocol, we will get a lot of professionals from very developing countries, and we don't need to train anyone. As soon as they come here, they can pass the exam, and they will start serving the community, and the government can collect tax from each professional. So, my nieces and nephews here in Australia, some are doctors. They, two of them are at a PA hospital working as doctors. So here we don't have that much placement for doctors and audiologists. There is a limitation, because when we studied, we could take PELS, the loan from federal government. Because at that time it was 28,000. Now it become to $60,000 to study Master of Audiology studies.
Yeah.
It's very expensive, and it's very hard for a normal person to pay $60,000 upfront and
There's
study.
a lot of money.
It's a lot of money. Nursing much cheaper. Maybe you can do it within $10,000. Nursing program, and you will get a job straight away. But audiology, limited number of seats, you need to have a high GPS score to get into the audiology program. And in many audiology programs, you will see a couple of speech pathology graduates coming to audiology, changing their profession. Because speech pathology, the problem with the speech pathology, to change a child's language difficulty or the speech and language delay, you need to have a couple of sessions. So the result will be slow. The change in a child's the speech correction, it will be a time-consuming thing. But
I remember back in the day, my neighbour, he had a bit of trouble with his speech pathology.
Mhm.
So every afternoon after school, he would sit there with his parents and actually go through cards and learning how to say words.
Absolutely. Speech pathology, speech delay is a big problem. That is why whenever a child having some speech delay, learning difficulty, the first thing the school teacher says is go and do eye test and hearing test.
Yeah.
They need to rule out that a child has got good vision as well as good hearing. Then only they can, even a doctor can refer the child to a pediatrician, because pediatrician will be looking at, okay, these things are tick tick tick, okay, so then we can address what is the for a pediatrician why the child is behaving this way. Okay, sometimes the child is not attentive in the classroom because the child is not hearing well. When you and me are not hearing well in a classroom, Brendon, how can we attend to a teacher? We won't be listening, we won't be paying attention to the teacher.
Exactly.
Yeah. And that is why audiology, many facets of area where you can explore. And in my case, and then I decided to start my audiology masters. And at that time, my wife was a registered nurse, ICU specialized nurse at a Royal Brisbane Hospital. And then I told her, if you do masters on audiology, can you change? If you can change the profession, you don't need to work at night shift. You don't need to work at night time. No one is going to die with a hearing loss.
Yeah.
And Monday to Friday type job, no weekend job.
Yeah.
But nurses, they have to. Many nurses need to work night shift. That is part of at least a 4 shift in a month.
I like that though. No one's ever died over here. Because being I guess you could say an ICU nurse, intensive care unit, you would have that kind of affinity with your patients, and then something happens, obviously, you're going to feel that too. So yeah.
Absolutely, I have noticed, okay, because if you are a very passionate nurse, definitely your supervisor will give very complex client to you.
Yeah.
And then okay, you will be sometimes one client or 2 clients, so the person will be tired at the end of the shift.
Yeah.
But in audiology, okay, it's not a life and death situation.
Yeah.
So
See you next week. But yeah, it has been an absolute pleasure. I know you're a very busy man because you have a lot to do, but for people like yourself, because a bit later on I'll be talking to a cancer specialist, and the irony is his last name is Joseph too, so I was thinking, I wonder if they're related. But lastly, before you go,
yes,
I would dare say you would recommend audiology to maybe someone who's just coming out of school thinking, what can I do with myself? May I suggest audiology?
Audiology, the prerequisite, Brendon, is the person should have qualification or degree in science, preferably science, or music, or physics, because as you know, sound is sort of waveform. You need to understand basics of it. If you are coming from economics or other specialities, definitely you may be they will ask you to, the university may ask you to do a bridging course, 1-year bridging course to get into the audiology program. But ultimately, whatever you do, you need to have passion. So
that's the key.
That is the key. Okay, as a broadcaster, you are the way that you present, Brendon. Okay, the enthusiasm, the energy. If you have that vibe in whatever walks of life you do, you will excel in your today or later. You will excel in life. And like me, as a single owner, single director company, that is also a possibility in audiology. You can start your own audiology clinic. Nurses, there is a problem. You cannot practice independently in a setting. But in audiology or a speech pathology or a physiotherapy, you can start your own clinic, and that is a freedom when you practice your own. But you need to have many skills: talking on a radio, talking on a TV, and broadcasting and managing social media, and good clinical skill, and interacting with people, always welcoming whenever a person comes to your clinic. So very beautiful smile, welcoming nature, it all matters. Not only the clinical skill, but people skill also matters.
Thank you so much, because I think that is one of the most important things, is to have that passion. Because I heard it said once, if you find something that you love doing, is it really work? But on that note, we were going to say goodbye to my brother, Mr. Joseph.
Thank you.
Solomon, if you do need help with your hearing, you're curious, maybe get the kids checked out, Territory Hearing, and the number is
047021 6004, or you can search on Google Territory Hearing and you will find me.
You are a legend, mate. Thank you. And enjoy your week, and we will see you on the next segment.
Absolutely. Thank you, Brenda.
All right, cool.
Okay.